Welcome to this segment of Health Views. This month's segment is going to take us into our new Rapid Clinic. We're going to find out about how the Rapid Clinic actually functions, its purpose, and the types of patients that are seen. Follow me and welcome to Rapid Clinic. Come on, follow me into the Rapid Clinic. Welcome to the Rapid Clinic. Our first guest today will be Christy Gustafson, Director of Clinic Operations at Grand Itasca and the Rapid Clinic. Welcome, Christy.
Thank you. Welcome to Rapid Clinic. Grand Itasca, service of Grand Itasca Clinic and Hospital. We opened the Rapid Clinic in January of 2013. In response to a lot of feedback we got from our patients looking for after-hours care and needing care that really probably wouldn't be appropriate in the emergency room, but yet there was something that they needed to have addressed before the clinic opened the next day. Rapid Clinic sees patients between 6 months of age all the way till as old as you can be to come in. We see a menu of items, basically single issue problems, things that we can deal with usually pretty quickly with minor basic laboratory work, maybe some imaging work, and a quick visit with one of our nurse practitioners or physician assistants.
As you enter the Rapid Clinic, the first stop will be at registration. We'll be visiting with Kari James, our registration specialist. Hi, Kari. This is Kari James, and she's the registrar at the Rapid Clinic. How long have you actually worked at the Rapid Clinic, Kari?
I've worked here since we opened January 2nd.
Okay, and how long have you actually been at Grand Itasca?
3 years.
Great. As a role, what is your role as a receptionist in the Rapid Clinic?
I check people in, I register them for their appointments. I make sure that all the information is correct so that billing goes out correctly, and that's a big part because there's always kind of a mess sometimes that things aren't in there correctly.
Great. Do you gather insurance information, those types of things, addresses, all those kinds of things?
And consent forms are always...
Once you've registered the patient, is your work done at that point?
No, sometimes I have to make follow-up appointments
okay.
So that they can be seen in the regular clinic after being seen here. Sometimes if we can't see them here, if it's not something suitable for here, I have to make appointments for over in the regular clinic as well.
Great. What do you like best about this job?
I like to work with the public. I like to see all the variety of people that come in and get to know people through that way.
I imagine on any given day there's quite a variety of people. Maybe give me an idea of a patient that you've registered.
I don't know, we just see all sorts of different things here. I mean, it's like a fish hook or something, and there's just all sorts of different people that come in and
Great. Well, thank you, Kari, for sharing your role in the Rapid Clinic. Our next guest is going to be Jen Pellersels, and she is one of the RNs in Rapid Clinic. Hi, Jen.
Hi, how are you?
Great.
Good.
And you're one of the nurses here, an LPN in the Rapid Clinic. How long have you actually worked at the Rapid Clinic?
At the Rapid Clinic, I've only been here for about 3 weeks now.
Okay.
I transferred over from the regular clinic.
So you've been seeing patients normally in the clinic. So, can you tell me about your role as an LPN here in the clinic? What do you do?
Okay. Once we know that they are here, we call them from the registration area, and we bring them back, and we'll take their blood pressure, pulse, all their vital signs. We find out why they're here, how long they've been here, what their symptoms are, if they're here for like strep or UTIs. A lot of times we do the labs ahead of time to get that going, and just to have all the information set for the providers.
Great. So what other personnel might they see if they come to the Rapid Clinic? Do you order labs or radiology?
Here we can do lab work, and we do x-rays, ultrasound, so we can order anything that is needed.
Okay, great. You also have some other nurses, I think, sitting next to you. Would you like to introduce us to your colleagues?
Sure, I can do that. This is Angie, and Angie is an LPN as well, and behind me is Emily, and Emily is an LPN.
Great. So how many nursing staff are actually working usually in the Rapid Clinic?
Most of the time we have 2 nurses along with 2 providers.
Okay, great. And could you repeat the hours of operation for us?
Yes, we are open Monday through Fridays from 2 till 8, and then Saturday and Sundays from noon till 6.
Great. Our next guest, well, thank you, Jen, for sharing your experiences here at the Rapid Clinic. Our next guest is going to be Jennifer Oja. She is a physician assistant here in the Rapid Clinic. Let's go visit with Jennifer. Hi, Jennifer.
Hi.
It's good to see you.
Good to see you too.
So, welcome to an exam room, and Jennifer is one of the physician's assistants here in the Rapid Clinic. Do you see all ages of patients at the Rapid Clinic?
We see anyone 6 months and above. So if you have anyone who is ill at that age range, anyone 6 months and above, young, old.
So what is your role as a physician's assistant when you have a patient here in the Rapid Clinic?
Well, once they've been triaged, once they come into the room, what I do is I sit down with them, I chat with them, I discuss their concerns, their illnesses, or if they have any cuts, scrapes, anything like that. And then I go through medications, make sure everything's current there, and then assess whatever they need to have done at that time.
Great. What types of concerns or situations do you actually see on a daily basis?
We see many different types of concerns. We see anything from simple bladder infections all the way to colds, pneumonia. We see any type of cuts, any type of rashes. Also, if you have any concerns as far as any type of breaks, like if you're concerned that you broke your ankle, anything like that, we can definitely see anything like that.
What happens if there is a more serious condition or a situation that you came in for? Let's say the patient thought they had a minor sprain and they ended up with a broken leg or something. What would happen then?
Well, we assess it and see if it is too much of a concern where we can't handle it, we can't fully assess it here in the Rapid Clinic, then we're easily able to triage them over to the emergency room, and we actually speak with the physicians over there, so it's a very easy transition coming from the Rapid Clinic going to the emergency room. Great.
So, what is the process for follow-up? If I had, let's say I came in and I had strep throat or something, would I come back to see you, or would I go to the regular clinic and see my provider?
You typically go back to the regular clinic as far as follow-up. We don't do follow-ups here in the Rapid Clinic. We assess the situation here, but then as far as follow-up the next day or the next week, whatever you may need, you typically need to go back to your regular provider.
Great. And how would your provider know what you were seeing for in the Rapid Clinic?
The providers that are in the regular clinic, they can actually see our notes here from the Rapid Clinic. So, and sometimes we're actually even able to talk with them if we have any concern that they're going to see them the next day. But typically they can see all of our notes here from the Rapid Clinic, so they know exactly what you came in for and exactly what happened.
So, and I assume they pull that up on the medical record or the electronic record.
Yep.
So.
Yep, on the electronic.
Can they, I think Kari mentioned this, but can they actually make an appointment with their primary care provider before they leave?
They can. That's what our receptionists are great. If you need to make a follow-up appointment the next day, or even with a specialist, Kari or whomever the receptionist is can help you make that appointment, get you all set up for whatever you need.
I think one of the concerns of any time you have an after-hours call is the cost, especially if you go to the emergency room. How do patients actually, what is the range of costs here at the Rapid Clinic? do you pay more similar to the emergency room or more similar to the clinic?
It's more similar to the clinic, actually, so it's great for the patients. They don't have to have a large fee as far as coming in for a sore throat or anything.
Sure. So it's more typical to the emergency room or the clinic situation at that point.
Exactly.
Great. So if there was anything you were going to share about a patient about coming to the Rapid Clinic, what would you tell them in order for them to prepare?
I would say, definitely have a good list of your medications. That's really, really helpful. If you have any type of drug allergies, anything like that, make sure and have everything written down, especially if you're going to be traveling from a location. We have anyone who's been seen here in the clinic or emergency room, we have all of those medications and allergies. But if you're traveling here, definitely a good idea to have that all written down.
So you don't actually have to be a patient then of Grand Itasca either. You could actually be someone from out of town that's visiting that can come and see you.
Exactly. We have many, many different travelers that are coming here, anywhere from Minnesota, Wisconsin, all across the country. We've even had some from Florida. So no matter where you're from, you can definitely come.
So it's quick and easy. Well, thank you, Jennifer, for sharing your insights on the Rapid Clinic. Our last guest in the Rapid Clinic is Dr. Paul Palaceck. He is the Rapid Clinic Medical Director. Welcome, Dr. Palaceck.
Hello, thank you.
Great. Well, welcome to the ICTV Health Views program, and I'm going to ask you a little bit about the Rapid Clinic today. What are the hours of operation of the Rapid Clinic?
Hours of operation are 2 to 8 during the week and noon to 6 on weekends and holidays.
Great. So, as the medical director for the Rapid Clinic, what is your role as that director?
Primarily, my role as a physician medical director is to be a collaborator with the physician assistants and the nurse practitioners that staff the Rapid Clinic. By Minnesota law, nurse practitioners and physician assistants have to have a collaborating physician, and I'm their primary collaborator.
Okay.
I do some of their chart reviews and quality control.
And I also know you work in the ER. I assume there are times that you come over here and see patients that might be in the Rapid Clinic?
I do. I've actually filled in a shift when there was a need, but just last night I came over to consult on a patient.
Okay.
I came over here physically and saw the patient, so they never actually had to go over to the emergency department.
So that's kind of some of the advantages of being seen in the Rapid Clinic. If it is kind of a questionable concern, they can contact the emergency room.
Absolutely. I'm their primary physician collaborator, but the staff here will often go speak to us over there and talk to my partners in the emergency department as well. And if we feel for whatever reason that the patient would be more appropriately cared for in the emergency department, we can just fairly easily move the patient over to the ER.
That's great. So the Rapid Clinic hasn't been open for a long period of time. Do you know what the reason was that we actually opened that, or Grand Itasca opened it?
Yeah, well, there's lots of reasons. We kept getting feedback from patients in the emergency department that they didn't really feel like they should be in the emergency department, but they were unable to get in with their clinic provider. It was after hours, or the clinic was busy, and they had a time-sensitive condition, but not necessarily an emergent condition. And so we talked about a setting for a long time that would be appropriate for those patients that, although their condition is not really in a true life-threatening emergency, it is time-sensitive. And so we talked about establishing a clinic that would fill that role, and the Rapid Clinic was born from that.
Great. What types of conditions or situations are actually seen in the Rapid Clinic?
So we have the Rapid Clinic, the way we devised it is what's some people describe as a menu type clinic, a complaint-driven clinic. And a list of those is actually on the Rapid Clinic website.
Okay.
Minor illnesses, minor injuries, minor skin conditions, and it even breaks it down on the website, conditions that may be more of a gray area that might be cared for here, but may be referred to another clinical setting as well.
Let's say I had a sore throat and a really high temperature, and I just, you can feel pretty lousy then, and so I can't determine whether I should go to the emergency room or the rapid clinic. Which would be the most appropriate in that situation?
I think that that would fit nicely in the menu of services provided by the rapid clinic. A sore throat isn't always strep, though, and it's not always as simple as it might seem. So after evaluation at the rapid clinic, that may be, depending on how high the fever is, it may be one of those things that they consult with the emergency physicians about.
Great. So most of the people, I think, in our community are used to going to the ER if there is, if they have something that happens after hours or they couldn't get into the clinic. How would you, kind of promote the rapid clinic to them so that they would actually, realize its usage?
Sure. I mean, it's not surprising that it's a habit and the culture here to go to the emergency department after hours. The rapid clinic's only been open 6 months. Clinics like this are available in other communities, but the website is, of course, a big tool. It's not just an advertisement for the rapid clinic. It gives the hours of operation, and it also helps you. There's a lot of information on there to help you decide if your particular condition is appropriate for the rapid clinic. And if it's not on that list of provided services, then maybe it would be more appropriate for the emergency department. Or if it's been a condition that's been going on for some time and you feel like you have time, then you could also set up an appointment with your regular physician.
Great. Let's talk a little bit about the regular clinic. I mean, have we seen a shift of people kind of ignoring the regular clinic and then coming to the rapid clinic instead?
I think my sense is, and it's only been open 6 months, and I think we need to be open a lot longer before we really get a lot of numbers and data gathered before we have that sense. But everyone involved so far, our sense is it really appealed to a new niche. So patients who are used to going to their regular doctor and like to go to their regular doctor, I would say for the most part still do that. And the patients who are used to going to the emergency department, many of them still do that same pattern. But the rapid clinic actually seemed to appeal to a new niche of patient that they just feel like it's not appropriate for the emergency department, but they can't get into clinic because they want to be seen in the next day or two. And the rapid clinic seems to fill that role.
I know I have sent several people to the rapid clinic as you get guests from out of town, or your family's visiting and the kids get sick. I've just said, we've got a rapid clinic now. It's a great place to go, and my experience here has been great. If you had an insight into what you would tell patients about why they should use the rapid clinic, what would that be?
It wasn't in the order section.
Good question. The beauty of the rapid clinic is efficiency. So to help drive that efficiency, we really need to adhere fairly close to that menu of provided services. So just keep an open mind if you do come, that it's kind of up to the providers to decide if you're off of that menu, or if you have multiple complaints, that would take away from some of the efficiency of the rapid clinic, and they may elect to refer you to another clinical setting. And if that does happen, don't be offended or don't be upset. It really is adhering to that menu and that list of provided services is what can maintain the efficiency and the flow through the rapid clinic and actually keep it rapid.
Well, thank you for that insight. I think that's really a key factor in the use of the rapid clinic. And thank you for sharing your thoughts today on rapid clinic. And thank you for watching this segment of Health Views.